Welcome back to the LCC Talk Show. My name is Julie. I'm your host for this afternoon. I'm so kidding. We just wanted to perk up your brain a little bit while we are getting ready for our last session of day one of this conference. You're back. Perfect. So I wanted to bring back our panelists. Danielle, I think Josh stepped out for a second, and Kelly for the last session. And we are focusing on life after the LCC diagnosis. So earlier today, we talked about leading up to the diagnosis, and it's very fitting that at the end of day one, we're talking about what is it like now. And for everyone in this room, I think it's great that we focus on this because we want to circle back to the individuals affected with LCC and how this disease affects the families and how we can move forward with treatment and helping and talking about everyday life. So that being said, we're trying to make this a little bit interactive. By the way, that's a beautiful picture of you ladies. I just noticed that. Okay, if you have a cell phone or any other device where you can take a picture and scan, we're going to make this a little bit interactive. If you can join this poll, there's a couple, I'm not sure exactly how many questions there are, so we'll try to go through some of the questions, and if it matches up, we'll do this at the same time. And then make sure you log on to that code as well. And then the people online will also hopefully participate as well, and we'll get, when we close the poll, we'll see how many people answer to which questions. While you take a few moments to do that, I just wanted to just touch base a little bit with our panelists. Sorry, this is all right. So I'm going to skip a couple questions because we talked a lot about this morning about like how we led up to this and whatnot. So now that we're focusing on you have a child or a family member with LCC, challenges. What is the biggest challenge that you or your family or your support system has faced since your child was diagnosed?
Is this on?
Yeah, that's on.
Hello. Okay. I think the biggest challenge is educating family and friends because they don't know about it. Another challenge is seizures. So teaching family and friends, school about his seizures, how to take care of him during a seizure. What was the second part of the question?
Yeah, what is the biggest challenge your family faced after diagnosis? And also you can also add what emotions did you experience after the diagnosis?
Oh,
Yeah.
so I think I said before when we got our maybe diagnosis, we grieved a lot because it was a lot of unknown. But after it was relieved that we had a diagnosis to move forward. And I think at that time we didn't know how to move forward. Our doctors were just like, we just go on day-to-day life, nothing will change. And really things didn't start moving until we got to DC. And that really, we started to get a real good game plan on what to do next.
The biggest challenges we faced is getting doctors to understand that when we say there's a problem, to listen. I talked about that earlier, and not knowing what's next at all, not knowing what the next step is, and that there's right now no clue of what's next. That's a big one that we are still facing, and hopefully one day, no.
Yeah, absolutely. And just based on this poll, there's 12 participants, and the highest number right now says not knowing what to expect for the future. So that seems to be the most common theme here. And this is a select all that applies, but it looks like it's all of it, right? So coping with the shock of the diagnosis, understanding what it is, explaining it to other family members, finding some information, and finding specialists. So yeah, so you guys are not alone there. Okay, let me just 1 second. Let me just make sure what the next question is before. Okay, no, we're not going to do that yet. Okay, all right. Looking back, what information, excuse me, or support do you wish someone had given you at that time, like practical information?
I would have to go back and say giving us information on the LCC Foundation, because when we did get our diagnosis, they didn't give us anything. And like I said before, I had to do my own research and find the LCC Foundation and find the Live Syndrome Facebook page and join that, and reading all the comments and what other parents are going through. I wish I knew that and I didn't have to do it, but I'm glad I did.
Ours was our neurologist when we finally got diagnosed. She actually brought up the LCC Foundation and Dr. Frazier. So luckily we did not have to do that. And more doctors need to be aware and informed. And that's what I hope that we can do with this.
Yeah. All right. So the next poll, which is now active for everybody, what practical changes helped your family adapt to life with LCC? And you can select all that apply. And for our panelists, so that way you're not telling them your answer, so that there's no cheating here. Tell us just daily life for you guys. How did it change, practically speaking?
I don't think our life changed that much because we were still managing his seizure with medications, still doing therapy, speech. The only thing we added with his diagnosis was PT and OT. So now we do PT and OT outpatient as well. He gets it in school and he was already getting those in school. We just added the outpatient aspect of it. But I do want to go back to what you said about feeling guilty on if you made the right decision, like not doing a therapy. I've gone back and forth with that, and I've taken Anderson out of speech for a couple weeks because life was just getting too chaotic and then going back to it. So it's okay to do that.
I was listening.
How does now having a child with LCC has impacted your daily life? Yeah.
Okay,
Practically
so
speaking.
ours is the keeping up with doctor's appointments and the therapies and knowing what's best. Like I said, I don't have to take off work anymore, but I did. So missing work and not really having a social life. Lucy is my main focus. It's very, I don't want to say lonely, but because I have a great support system and everything. But it can feel like you're doing things on your own, even though that your family's impacted as well. When you're the main caregiver, it's lonely, and that's something we struggle with.
Yeah, no, definitely. All right, so I think we're all done with the poll. It looks like what practical changes helped your family adapt, and it looks like the number one answer is connecting with other LCC families or rare disease communities. Do you guys agree with that one? Yeah. Okay. And then there's a tie between learning more about the condition and taking one day at a time to adjust expectations. And then the last three were also tied, but it's organizing meds, appointments, like medical records, hospitals. It seems like adjusting school plans, accommodations, and maybe I can't read the answer for the last one, but maybe receiving help from extended family was less. So it seems like a lot of people have support from extended family members and friends in the community. All right, let me see what the next question is. Don't look. Okay, we're not gonna do that one yet. All right, I'm keeping them on their toes too. All right, how speaking of like therapies and doctor's appointments, whatnot, how has your relationship with doctors, medical specialists, even school has evolved?
So we started out at a city school, and we have now moved to a county school, and it has been a tremendous difference with the one-on-one with Lucy. Now, therapy-wise, we are having issues with Medicaid, wanting to discharge her for 6 months at a time or not getting re-valves, and then them telling us it's not time for that yet. So when it is time, we got to get another eval, and it's just a really hard process. And then not being heard from doctors, that's a big one, and that's the one I stand by this whole time, is not being heard, because I struggled with that for 6 years.
I have to say our school system is really good and they listen to what I have to say and they want to learn more about LCC. Like I said before, I hand out my stickers to everyone with the QR code so they can learn more. What was the rest of the question?
How's your relationship? It's okay.
It's like multiple
Yeah.
questions.
How is your relationship with the doctors or the healthcare?
Oh, okay. So back in Rhode Island, I felt like I was let down a lot. It didn't give me the confidence to move forward with them, if that makes any sense. But now here in DC and we have a plan and things are moving forward, my confidence has gone way up. Yeah.
Okay. All right. And what advice would you give families to be an advocate for their child, whether it's in the medical system or at school?
Never stop talking. Keep talking, keep saying what's on your mind. And it doesn't matter if you're being a pain in the butt, but just keep on going.
Follow your gut.
Yep.
They say just follow your gut, okay? Because that was the biggest thing, is I didn't step up or speak loud enough to get something done for her, and I failed her on that part.
You did not fail.
Nope.
But that parental gut though is so real. And that's the first instant. And usually that like in this case, mama bear gut is totally, yep, it's always right. All right. Now this is for everybody. What have you learned about balancing hope with uncertainty?
Am I supposed
You
to
can
answer
answer
that?
first,
Okay.
Yeah.
I thought they were had to go first. I think my hope is this doing this and being involved with the LCC Foundation and seeing how much effort our doctors are putting into LCC definitely gives me a lot of hope knowing that what's going to happen next year. What do you got planned, Dr. Frazier?
You said it.
There you go. All right. Everybody says it's okay to feel hopeful and afraid at the same time, which is so true. It's so true. Yeah. Yeah. Learning to celebrate small victories and meaningful moments, participating in research and advocacy is big. Oh, it's moving so much right now. I don't know what's happening. I thought I was keeping up with this. Okay. Focusing on what we can control today seems like the second one. Yeah, no, these are great answers. Okay. Let's see what's next. Sorry if you haven't finished this poll. It's still going. Okay, not yet. Actually, okay. All right. How has having a child or family member with LCC affected relationships in your own family or friendships?
I would say friendships not understanding why we have to travel to DC for doctor's appointments. They don't really understand that and they don't really understand. I wouldn't say just friends. I would say everyone doesn't really understand how serious this is. They take it as that, oh, he looks fine, he's acting fine, but he's not. Yeah.
You're right.
Yeah. Okay. And being either an individual with a LCC or being a caretaker of LCC can just be a lot. How do you all take care of yourself? What are some wellness things that you do for yourself? We might need to have a wellness session next meeting. I'm putting that out there right now. Putting that out there. That was a long pause.
Around us, and she's attached to my hip, so it,
Yeah, I would have
Yeah.
to say that. And I think
Yeah.
everyone has seen in this room that taking turns
Yeah.
when one parent is getting stressed out, taking turns with that because it is overwhelming and it is frustrating and
Yeah, absolutely. Clearly Josh is not in this room right now on this panel. He is helping with AJ. Okay. All right, but I'm part of a well-being committee at our hospital, and even for clinicians, well-being is very important. So for families, I think it's even 10 times even more important. So we should definitely focus on that for the next conference. All right, just
we should try to do a LCC parent night out.
Ooh, I like that. All right, everybody think about what ideas you have for the end. We're going to open up to the floor. All right, for the sake of time, I'm going to jump a couple questions if that's okay. All right, let's see. Oh, can you share a moment when another LCC family made you feel less alone?
I think the night I met Ashley in Boston, she was in Boston and I live right there and she said, let's meet up. And I think that night talking with her and I think we were sitting at the restaurant for what, 4 hours, just talking, and that made me feel less alone. And that also made me feel like this is real. This is real because you see these people online, and you don't think that they're real people until you meet them, and that was a real eye opener for me.
mine's kind of the same. Just getting in contact with Miss Ashley. She was great. I think we talked on Zoom for 3 hours, just about life in general, us, the kids, and then coming here and seeing Lucy last night in the pool with the kiddos, and has moved on today being attached to their hips, and has been amazing to know that there's other like her.
All right. And what strengths have you discovered in yourself or in your family that you didn't know existed?
Love. I know that's crazy to say, but they have been so supportful, so there, and anytime I need them, they're just a phone call away.
Ditto. The answer up here. No, that's so amazing. Yeah. And your children have shared love with us as clinicians as well. Yeah. Yeah. Okay. All right. I'm going to do the next poll. Give you guys a moment. All right. So this is for the audience. What is one thing you wish researchers, clinicians, or advocacy organizations better understood about living with LCC? All right. And while you take that, we're gonna do the poll, but we're also gonna open up the floor for questions. But while you guys are still thinking about this, I wanted to ask our panelists just one final question. Despite all the challenges, what gives you hope today?
This
Yeah, the kids.
Support from everybody here. And of course, my family as well. But
Yeah, big shout outs to all the support systems in the room. Yeah. Yeah. All right, so looks like people are typing, but I wanted to actually, if you feel weird typing, you just want to talk, I just actually wanted to make this a more of an open discussion now. Yeah, tell us, what do you want us to know? What do you wish people who are studying this disease or learning more about it or taking care of kids with or individuals with the disease, what do you want us to know? And what questions do you have for each other? We'll just keep this open. And then Mr. Danny will walk around with the mic.
My name is Nick. I'm one of the pediatric epilepsy doctors here in St. Louis. I take care of a lot of patients with genetic conditions and intractable epilepsy, and we are continuing to push for earlier genetic testing. And the new recommendation is really to test anybody with unexplained epilepsy. And I know the push in the CP clinic is to do early testing as well. I've had a few instances where I've had patients where that diagnostic journey was taken, in the sense that we did early testing and we identified something that was progressive. And I've had families make comments about, we lost hope. Now all of a sudden that future has changed. So one of my questions is what advice do you have for clinicians like myself for actually talking with families when this type of thing happens? Because I think we're going to see more and more younger patients diagnosed as we do more testing, and the future is uncertain. And that was one of the big kind of comments. I would love families' kind of thoughts on what we can do better as clinicians in talking about this.
Do you want to go?
Yeah.
I think from when we met with Dr. Fraser also, straightforward, tell us what we know. We don't know what's going to happen, but tell us the worst case scenario. Tell us, don't give us hope if there is no hope. Straightforward.
I want to add to that. And I think sometimes when we talk to doctors, they have their doctor face on and they talk to us like doctors. I think talking to us like humans, you guys are probably parents too and are dealing with your own life. Just talking to us like we're humans or a friend, that would definitely feel us. I don't know, that would make me feel better talking to us like that.
Anyone else want to contribute to that? Dr. Bajaj?
I'm not a parent or a parent of a child with a rare disease, and parents, please corroborate this or not. But what I've also learned in the literature as a palliative care doctor is that often in situations where there's a lot of uncertainty, families want you to be honest that there is a lot of uncertainty, but they also don't want to just be that point to be belabored over and over. They want to know what are the action steps, what isn't known, but what is known, and what can we act upon, and how can we move forward in that way. I don't know if that resonates with anyone, but that's what the literature says.
So practical things. Yeah. There's a lot of head nodding. Yeah.
Yeah. And I'll add a little bit too, because it's tough because you don't always have this awesome clinical setting where and we deal with this with Dr. Fraser and a lot of the specialists in the room here, where we go and it's a full clinical team. And you don't always have that, right? But I remember when Dr. Bajaj came in and Fraser said, we're bringing in palliative care, doctor. Don't freak out, because people have in their mind what that means, right? And she was awesome, right? Because it meant a lot. Oh, now I'm going to get emotional here, but it meant a lot for our family to have that support system. That wasn't just, here's the epileptologist that's going to tell me what it is, or the neurologist that's telling me there's this thing and we don't really know about it, but and I don't know how you practically do that, but having that clinical care team that can really say, this is rare, it's different, and we've got multiple people that have different specialties that are able to help educate and work through that.
Dr. Fraser said that she's putting in a plug-in for genetic counseling. Sorry, for the people online who can't hear. Yeah. I got you. I think for my perspective, every individual with LCC is special, and we don't know what's special about every person that we're seeing. So I think being really honest about what works and what doesn't work really helps us help you make decisions for care. And sometimes whether that's the whole team in the room, which it seems like a lot of families like, but sometimes maybe that's too overwhelming, right? And so just knowing, being point blank with us, I think is helpful for us to know what your priorities and what works for you. Any other comments?
One of the things that helps us as people who take care of folks with LCC is to know what is working and what doesn't work, right? So when something's ultra rare like LCC, we have a set of tools in our arsenal, and we will try things. We will say, let's try this clonidine, let's try this other thing, let's try this third thing. And sometimes it'll work for a while. Sometimes it doesn't keep working. And so one of the things we are going to ask of you guys is to tell us if something stops working or you need something else. Okay. And if there's a challenging behavior and then somebody tries something and a medicine works, if you tell us, we have it in our arsenal for their next person. But if it stops working, you tell us. That's the one thing I wanted to say about that. The second thing I want to say is this room is so full of love and so full of hope and yet appropriate fear and grief. And I just want to thank you all for being so vulnerable and for loving your people so much. I tell people individually this, but I'm going to say this too. There's nothing anybody in this room did that made LCC happen to somebody they love or to themselves. And there's nothing anybody could have done to prevent it. But you're doing all the right things to take care of the people you love every day. And I want people to hold on to that. Okay. And keeping your eye out, Barsh, for when the therapy is maybe not the best thing, you have my permission to say no. I know, but you always have permission to say no. Okay. There you go.
On that note, I actually have a suggestion for the LCC Foundation for tomorrow. There's something, now I'm blanking on the term, but it's another QR code that hopefully we'll do tomorrow. I want, for your homework, for all the families and individuals at LCC, I want you to come up with one thing about yourself, one word that describes you or your child with LCC. And we're going to, include the families. Families. Perfect. Include the families. Yep. Think about that word. We're going to do a QR code and we're going to, what is it called, Dr. Bajaj?
Word cloud.
Word cloud. Thank you. I was like blinking up here. Word cloud. We're going to do a word cloud. And I want to save that word cloud. And I want you guys to look at that every year to be like, this is what it means to care so much about this population. And because all of these individuals have these characteristics. So I want to do a word cloud. I think that'll be a great way to end this conference tomorrow with just all these fabulous words that you guys will come up with in the next, I don't know how long you guys will sleep for tonight, but that's your homework tonight. But before you leave today, I want you to look at the words that are on the screen for the clinicians in the room, the researchers in the room, even the families and individuals. This is what you guys said. This is what you wish you want people to know more about. And this is just a glimpse of what is needed to be done. This is just a glimpse of what you are struggling with, what you're going through, what hope you have in the clinical team and the research team. I want to leave with that glimpse of hope that these wonderful panelists has talked about, sharing their stories with their children and you guys sharing your stories with us as well, that this is an active battle and we're here with you and it's not over. And we have another day of learning about this. And I hope you all have a wonderful evening just reflecting on what you learned today, and let's come back tomorrow refreshed and rejuvenated. And yeah, let's fight this disease together. So thank you all so much. And I think that's the end of day one. So thank you all. Thank you.
Thank you.